So let's talk about the pelvis. So we've got our sacrum and our innominate bones, right? These three bones make up the pelvis, along with a piece of cartilage in between them in the front. Comes together like that, for lack of a better way to show you. Okay, now we're gonna throw one to the side because I only have so many hands. When our leg goes into flexion, right, knee up towards your chest, the innominate bone follows it in posterior rotation. So it moves at the SI joint like this. Okay? When we go into extension, it does the reverse. It goes into anterior tilt. So as I move my leg into extension, right behind me, my pelvis half needs to do that. The unique thing about our body is one leg usually is in flexion and the other one is extension when we're walking, running, right? We're doing split leg activities like a lunge. So now we'll drop the sacrum so I can hold both bones. So when I'm in the running position with my left leg up, my left innominate is like this and my right is relatively extended. The more I move my leg into extension on the right, the more my innominate will go into anterior rotation. So you see how the innominate bones, then when we alternate hip flexion and extension, need to do this, right? Of course, I'm exaggerating the range of motion so you can see it better, okay? But what I want you to think about is when we're cueing people in a split leg position, a lunge or a running motion, if we're cueing the pelvis to do one thing, right? If we're cueing the pubic bone, we're cueing the sits bones, we're cueing a muscle, right? If we're telling the muscles tighten up the core, which most people feel like is an abdominal tightness, that might take the top of the ilium and bring them closer together or closer together in the front. This is going to limit them then able to move into rotation. Does that make sense? Same thing if you're really over cueing the glute squeeze, then the ischial tuberosities will come in the back, and this winds it up and limits this motion too. If you cue pubic bone towards the nose, you're bringing both of them in pelvic rotation, which is gonna really limit the one going into hip extension, which is gonna cause all sorts of problems, right? You can cause excessive hip anterior glide and hip pain, or you can just create some faults in the lumbar spine as well, right? So we want to allow these innominate bones to move freely from each other. Y'all love this when I use the rotator disc, right? Thinking of those guys as pinwheels. So we practice that with a hip hinge, using the pinwheels to come up and forward. Now we're going to use the pinwheel to do opposite, right? So when I march my left leg up, my left leg goes into posterior rotation and my right leg goes anterior and then down. And when I do this and think about how that feels with the innominate movement, what it does is it keeps me really centered over my stance leg and connects me into the core, right? So here's how it will look the opposite. So my right leg goes into posterior tilt, my left leg goes into anterior. Solid as a rock when that happens. Versus if I'm thinking about staying tall, tightening my abs and squeezing my glute, I have to shift my weight over to the side to allow for some sort of aberrant motion to happen, because I'm not allowing the motion to happen in between the SI joints. So SI joint mobility is key for good, healthy movement patterns, and allowing that, especially in split leg positions.